Hello, my name is Dr. Ryan Meredith, and I'm one of the podiatrists here at InStride Gas Foot and Ankle. And I am here today to talk to you about a problem that's running rampant in our society that's going undiagnosed quite a bit, called PAD, or peripheral arterial disease. This is where people get clogged arteries in the blood vessels of the lower extremity. It can happen in the upper extremity as well, and in the aorta, causing heart attacks and strokes. But a lot of times there's a silent problem in the lower extremity. It needs to be identified via some testing that we're doing, and we do a screening test based on your answer to a survey that we take. So people that are at high risk are people that have smoked or, or had smoked, people that are diabetic, people that have pain in their arms and legs or tingling or burning, or people that get pain when they exercise, when they walk. So we're doing a test called an ankle brachial index, which measures the blood pressure in your legs and compares it to your arm. This is one of the tests that can be used to identify clogged arteries in your blood vessels, but we're also doing an advanced test called a pseudomotor test, which measures sweat gland function. This is not commonly performed and is a very high indicator of small vessel disease, which is very important to us because we deal with a lot of non-healing wounds, in particular our diabetics. The microvasculature of the blood vessels that goes to the toes of the small blood vessels get clogged even easier than the large blood vessels. And this is a common cause of diabetic peripheral neuropathy, or DPN. People that have the diabetic peripheral neuropathy and also the vascular disease are at a high risk for non-healing of a wound once it's developed. What we like to do is find out that you have this problem before you end up with a sore that doesn't heal and end up going on to an amputation. Because we know that in our diabetic population, 25% of our diabetics will get a sore on their foot, and half the time it goes on to an amputation. Once the patient has an amputation, the rate of living only 5 years is only 44%. So we would like to do a screening on our patients to avoid the consequences. We're also doing some blood work that measures their cardiovascular health by taking a small blood sample and doing the MD Heart Pro program panel of blood composition that's measured by the Cleveland Clinic and recommended to assess you for potential cardiovascular events such as heart attack or stroke. So come in today and get your screening. It's covered by your insurance most of the time, and the idea is to stay a step ahead, and prevention is the best form of treatment in disease like this so that you don't have a catastrophic event as we just described.